nurses are balloting whether to go on strike. Is it fair? I asked the health minister, the DWP minister, this earlier on the programme. Is it fair that this government is lifting the cap on bankers' bonuses, but refusing to give nurses above inflation pay rises?
Well, I don't link those issues because I think, frankly, the bankers' bonus cap was something that banks found a way around anyway when they wanted to get money to their key staff. So I think it was a bit of a nonsense. But I think your broader point is valid. We should not be asking public sector workers on lower pay to make sacrifices at the same time as we are reducing the tax burden on people who are higher paid, which is why I think the U-turn on the 45p rate was absolutely the right thing to do. That said, I think you probably say I would say this. There's a whole chapter on the junior doctors' strike in the book,
Yeah.
but I don't support strike action by NHS staff. I don't think that's the way to resolve these issues, but I do understand how desperate nurses are feeling.
Liz Truss is standing firm. You talked about the U-turn on the 45p tax rate, but she is standing firm on a real terms cut in benefits as things stand. It's a live discussion at the moment. Would it be a mistake not to increase benefits in line with inflation, given that a lot of working people are on benefits? 40% of people on benefits are working.
I think the country understands that we are in a very, very difficult situation financially, post-pandemic, with the cost of living crisis, Putin, Ukraine, and so on. But if you're going to ask people who are on low incomes to make sacrifices, then it has to be part of a package where you can demonstrate that everyone is going to be asked to make sacrifices. So I don't think you can look at these things in isolation. That's why I think the messaging around the 45p rate was so damaging, and I'm really pleased that we've changed tack on that.
But now she's done that, does that give her cover to cut benefits in real terms or not?
Not on its own. I think on its own people have got to see a package where you go to the country and you say, look, this is tough, and everyone's going to pay their share of the burden. And
So she needs to do a U-turn on what else?
Well, I'm not saying she needs to do more U-turns. I'm just saying that there needs to be a package which people look at and say, on balance, this is fair. If we're not going to give inflation rises to public sector workers, if we're not going to uprate benefits as much as we want, then people on higher incomes have also got to make their contribution to the difficult times that we're going through.
Liz Truss has had a pretty torrid start to her premiership. If the poll leads carry on giving Labour easy double-digit leads, is there going to be a clamour for Rishi Sunak, who you backed for the leadership, to step in to stop you getting absolutely wiped out of the election?
Well, Parliament's not sitting at the moment, so I can't speak for the mood of my colleagues, but I would guess that most people think that we should give the new Prime Minister a chance. I think people recognise that the polls move around much more quickly these days than they have in the past, and who knows what big international events are going to happen in the next year that could change people's views. But we do need to win back the trust of the British people after a torrid year, and we can't pretend as Conservatives that we're in the position we want to be anything like, and there's a lot of work to do.
So she's not got unlimited time. She's got to turn it around pretty quick.
Which hasn't got unlimited time because we've got an election probably in the middle of 2024, but there's a lot of work to do to regain trust.
In sort of 25 seconds, what your prescription is?
Basically, this is all the things I wish I'd known when I started being Health Secretary, that I came to understand. And what I'm really saying is we need to make some long-term changes to get the culture in the NHS right. My top three things are train more doctors and nurses because we have a massive workforce crisis, scrap all the national targets that turn patients into numbers, and go back to people having their own GP, because when we turn general practice into going to a call centre, it's much more dangerous. People are far more likely to miss cancers and all those other diseases. But really, it's, the NHS is the 5th largest organisation in the world. You arrive with absolutely no training, and it's quite overwhelming. And 3 lockdowns gave me a chance to sit down and say, what the hell do I wish I'd known right at the start?
Well, a lot of what you've raised, I'm sure Liz Truss would say, OK, great, yeah, we'll do that, but where's the money coming from? So I wanted to put to you something that Dr. Rachel Clark wrote. She wrote some very nice things about the book in the review she did for The Guardian. And she did, though, take you to task on NHS funding. So I wanted to put to you what she says. The 5-year agreement for 3.4% annual funding increases that you agreed as Health Secretary failed to address the crippling impact, she says, of austerity budgets. It didn't even match the average long-term NHS funding increase of 3.7% since 1948 and was criticised by the National Audit Office as being inadequate and unsustainable. So how do you solve that?
Well, you can look at these things in different ways. You can say that when I arrived as Health Secretary, it was on 0.1% annual increases, and I secured a £20 billion rise, which is about 1% of GDP, that put it much closer to its long-term average. Is it enough? It can never be enough. But what I would say with the NHS is that we are now the 5th highest amongst all OECD countries, all the richest countries in the world, in terms of the proportion of our GDP that we spend on health. Only 4 countries spend more than us. So it does need more resources. I think the charge is justified when it comes to social care, by the way. But when it comes to the NHS, it isn't just about money. It's about how we spend that money. And the biggest problems are caused by the fact that we don't train enough doctors, and we end up spending £6 billion a year on locum doctors and agency nurses. And when you have that kind of level of waste, then inevitably you're going to find that resources aren't going as far as everyone wants them to.
Is it still politically toxic to talk about reforming the way the NHS is funded? Should that debate be had? Should we talk about people paying for certain NHS services that they don't currently pay for?
Personally, I think it's a rabbit hole because, we could do that. We'd have an immensely toxic debate. We'd probably end up where we started. And actually, the fundamental things that would make it easier for people to see a doctor more quickly are training more doctors, getting rid of the bureaucracy. I mean, the targets, Cathy. The truth is that, Therese Coffey arrived as Health Secretary. The first thing she said was, I want to have a new target. Everyone can see a GP within 2 weeks. But that is the 73rd target that GPs face. They are micromanaged to death. And we have the most centralised system in the world. We don't tell a head teacher of a secondary school in Cheltenham how many physics A-level passes they're expected to get next year. But that's the kind of micromanagement that you get from NHS England to every doctor. And it's not surprising that they feel that they are so overwhelmed with bureaucracy, they can't spend time on patients.
We'll come back to the book. I just wanted your reaction quickly to the news about Conor Burns being sacked from the government. What's your thoughts?
Well, on a personal level, I'm very sad the incident happened. I know Conor, he's a friend of mine, but I can understand why Liz Truss has taken the action she has. She obviously does not want to be accused of the cronyism that Boris Johnson was, and she wants a clean break with that, and that's why I think she's acted decisively and rightly.